I think that in the upfront setting, the data is coming in fast and furious, let's say. But it's welcome data. It's data that's showing improvement in overall survival. It's data that's encouraging. It's data that shows combination of chemotherapy plus an immuno-oncology drug, usually PD-1 or PD-L1 antibody, is in fact a combination that can improve clinical efficacy. Moreover, it appears that the side effects are consistent with what we have been expecting or seeing from earlier studies. I think the amount of data could be a little bit overwhelming, the rapidity with which everything is being released. But if you take a step back and look at the overall sort of goals of the studies, you'll see that it appears that the combination of the chemo plus an IO agent is in fact a very active combination for majority of patients who do not have a driver mutation adenocarcinoma. We're hoping that the data that's about to come out would also show a similar pattern for patients with squamous cell carcinoma, but we don't really have that data at this point. So immuno-oncology combinations now come in a couple of different varieties. So we have chemo plus an immuno-oncology, and then we have at least one phase 3 study that has shown positive PFS in Checkmate 227, which is a combination of two different immuno-oncology drugs. The major issue with Checkmate 227 at this point is that the combination of ipilimumab and nivolumab is not an FDA-approved combination. The biomarker that was used in that study, tumor mutational burden, is also something that is not commonly used yet. So I think that the IO-IO combination has a little bit of a challenge ahead of it right now, just because, again, it's not approved. On the other hand, combination of pembrolizumab with carboplatin and pemetrexed has been approved for over a year now in the U.S. based on the phase 2 study, and the pickup for that has been a little bit faster, and people have gravitated towards that even before the confirmatory Keynote 189 phase 3. I don't think we're done with IO-IO combinations. I don't think we're going to see anything new in the frontline setting for a while, but I think the push is there to come up with better IO combinations to improve even further on the current clinically efficacious combinations that we have.